If you're an expat or an immigrant to Mexico, or getting up in age, like some of us, you are always thinking about access to quality medical care, all right? It's always on my mind. I'm always doing what ifs. What if I have a stroke? What if I, whatever, what do I do and how do I plan ahead? Someone years back, probably 4 or 5 years ago, told me about Lakeside Medical. What they told me was contrary to every single thing I read and heard about Medicare, okay? About being able to access Medicare or your insurance plan here in Mexico. Then in November, I went to a seminar at Mac Hospital where the doctor was there. He's going to give the same presentation today. And I understood why I had to go home immediately and sign up for Lakeside Medical. How many of you are members of Lakeside Medical? Well, I bet you we'll see a change in that at the end of today. So at the end of the seminar, I talked to the doctor. I asked him, I said, you have to come and talk to Rotary and tell us about your program, and he agreed to do that. Dr. Ezquerra is the primary care physician and medical director for Lakeside. He is also a flight medical assistant for medical air evacuation. He is a graduate of the medical school at the Universidad Autónoma in Guadalajara and is currently a professor at that same university. So doctor, let me waste no more time and come and talk to us about Lakeside Medical. Thank you for coming.
Thank you. Hi everybody, I'm Dr. Javier. I'm medical director for Lakeside Medical Group, and I'm going to divide this talk, it's a quick chat, in how to use your Medicare here in Mexico and how does Lakeside Medical works, okay? How many of you have Medicare Advantage plans? Okay. How many of you have supplement plans? Okay, and how many doesn't have any insurance from the states? Okay, so this talk will help you. Medicare is divided in 3 parts. The original part that it's Part A and Part B. Then we are gonna have Part C, that it's the Advantage plans, and then we have the supplement plans that they are gonna be with different letters. It can be Plan F, Plan G, Plan N, Plan different, okay? So Medicare Part A, it's going to give you your hospital coverage, okay? Your Part B, it's giving you your doctor's coverage. And Part D is giving you your drugs, your medication in the States. And with these 3 or 4 things, you will have Part C that is giving you the Medicare Advantage plan. The Medicare Advantage plans, they look for preventive things. So that's why they give you extra benefits, like it can be vision programs, memberships to any gym, or any of those types of benefits. For insurance, it's cheaper to have healthy patients that have patients in a hospital. So that's why the Advantage plan is giving you these benefits, so they can have healthy patients. Okay? Medicare Advantage plan, it's a private insurance coverage, okay? That's why the benefits is gonna be different depending on the career that you're having. Also, depending on the career, it's gonna be the depending of type of coverage that you will have outside of the United States or in the United States, okay? Normally, all the Advantage plans, they will give you coverage for emergency and urgent care situations, okay? There are some Advantage plans that, depending on your zip code, they can give you comprehensive coverage outside from the US, yeah? An example is some insurance from address from Alaska. They give you this type of coverage because the amount of people that they are registered in that area, it's not enough, or they don't have enough networks in that area, so they can give you extra coverage. The Part D, that it's the pharmacy, this is very important to mention. Part D doesn't have coverage here in Mexico or out of the US. These benefits, it's only gonna be for you when you are in the States and you want to refill your prescriptions. That's the way that you will have this type of coverage, no out of overseas, okay? Okay, how do we know how to, that type of services that I'm gonna have? This is gonna be depending on your zip code. Your zip code is gonna be your service area that you're gonna be having in the US. This is very important to know that you must be, or you must have an address in the US to be registered with Medicare and be registered in an Advantage plan. PO boxes, they are not accepted. Yeah, so you need to have an address on the States. Okay, it can be a relative or something that it's your base in the States. It's gonna be dividing the type of coverage between in-network and out-of-network. In-network, it's gonna be all the providers that the carrier is having on your area. And out of network, it's when you can use any provider that takes your insurance. For Mexico or out of the US, this doesn't matter. Normally, all the providers are out of network. It's very weird that there's a provider that it's in network for an international coverage. Okay. So when you choose, this doesn't matter. So you will have some benefits for inpatient or outpatients. If you are a long-term resident in Mexico, the out-of-network is the one that you will be more interested to know. The good thing about Advantage plans that most of them, they don't have deductibles, they don't have premiums. Most of them, they are free, that they are charged, reducted from your pension check, your security check. And as I was telling you, there are extra benefits that it can be dental, vision, hearing, gyms. This that it will be incentive for you to have a healthy part. Also, a good thing about the Advantage plans that it's separate from the supplement plans, besides that they have premium, the supplements, is that the supplements, they will only cover you for the first 60 days outside of the US, and you need to prove when you get out of the US. It needs to be a stamp in your passport, it needs to be a ticket or something like that. Remember that sometimes when you cross the border by car, you don't have a stamp or something to prove that you are out of the US. And this is gonna be a big problem. Also, for the supplement plans, they will give you a maximum coverage of $50,000 US lifetime, okay? And some Advantage plans, they don't have maximum of coverage. That's a good difference to know. Most of the plans, as I was telling you, are 0 monthly premium, and most of them, they will cover you worldwide emergencies and urgent care situations, okay? The way that it's gonna be is that you will need to pay out of pocket, and then you will ask for reimbursement to your insurance. This is something to you to know. Try to always pay it with a card, because they will ask for proof of payment, the insurance. If you do with cash, they will not reimburse you, okay? This is gonna be separate, because when a patient is registered with Lakeside, they don't pay anything. The Lakeside is the one that is responsible of the bill and all the co-pays, deductibles, co-insurance, everything that it's those expenses. So that's a good thing. Also, some of the insurance carriers, they will not do direct payment to providers, and that's why you will need to pay. Try to stay with someone or a carrier that can give you direct payments to providers, okay? There's no 60 days limitation. They don't have annual limitations, and there's no deductible for emergencies and urgent care on the Advantage plans. Okay. These are some diagnoses or situations that you can have that will give you the coverage for emergencies. They can be some things that they are live, that you need to have treatment immediately, or they can be some mild, like a fever, urinary tract infections, things like that. They can get covered here through your Advantage plans, okay? These are some smaller situations, fever, cuts, wounds, boils, that can give you this information, okay? The Part B, it's your premium part that it's taken from your Social Security check that it's gonna be paying to the carriers, so that's why they will give you this type of coverage, and that's why it's free. The Plan F, G, N, K, all those ones that are supplements are the ones that I'm telling you. They're only gonna be covering you for the first 60 days, lifetime, plus co-insurance, plus your annual deductible, plus your monthly premium. It's more expensive and will not give you more coverage. If you are part-time resident, you need to check if it's good for you or not, because once that you quit for the supplement plan, it's hard to go back because you will, if you have pre-existing conditions. The Advantage plans, they don't care if you have pre-existing conditions. Another thing is that you will find some plans that they will tell you if it's a PPO or a HMO. HMO is a health management organization that you would need to have referrals so you can go to a specialist or to have any study they get done, no? And PPO is that you can go with any provider that can take your insurance. For international coverage, doesn't matter because we don't go if it's HMO or PPO, okay? As I was telling you, you must have a US resident and must have age 65 or more. There are some exclusions that if you have a disability or you have something else, you are candidate to have an Advantage plan. There are two enrollment periods. One is the annual enrollment period that was from October to December, and there's now one that it's a special enrollment period that it's gonna end on March. Who can use this enrollment period? The ones that are from the October to December, it's anyone that doesn't have any Advantage plans, okay, that they are gonna be new. The ones that they are from January to March are those ones that they have an Advantage plans and they want to change of any career, okay? There are a few careers that Lakeside doesn't take. Yeah, if you want, I can mention those ones so you can be aware, and I can explain you why we're not taking them, okay? Then let me explain you a little bit of who is Lakeside Medical Group. Lakeside Medical Group is an HMO. We work like an HMO here in Mexico. We have direct agreement with more than 350 insurance companies from the US and Canada, and some travel insurance from Europe. Okay? We have network providers around Mexico, so if you are traveling in Mexico and you have an emergency or an urgent care situation, you can call Lakeside if you are already registered with us, and we will refer you to the nearest provider so you can get that type of coverage. We are located in Ensenada, Rocky Point, Nogales, Hermosillo, San Carlos, Mazatlán, Puerto Vallarta, Guadalajara, Chapala area, Tepatitlán, and a small place in Michoacán also, Mexico City, San Miguel de Allende, Mérida, Cancun, and if everything goes good, we will have new places that we can give you coverage. In case that you are in a location that we don't have coverage, What we're gonna do is we will offer you transportation by ambulance to the nearest place that we have coverage once that you are stabilized. If you are in conditions to move to one place to another one, we can cover the ambulance to one of our closest network places. A good thing about Lakeside is that it's free. There's no cost for enrollment. There's no financial responsibility. The only cost that you will have is the copays that we charge, okay? If it can be 100 pesos, 500 pesos, or 3,000 pesos. 3,000 pesos is for inpatient admissions that they are more than 24 hours. 500 pesos if it's less than 24 hours, and 100 pesos if it's an office visit or labs, okay? Lakeside Medical Group, on those 350 companies that we have agreement, we also take TRICARE, CHAM VA. Those ones, they will give you a different type of coverage. Example, CHAM VA gives you comprehensive. You can have routine exams, you can have follow-ups with the doctors, same as TRICARE. VA, it's different. VA will give you only coverage for service connection disabilities, and you must be registered with a foreign medical program of the VA, so you can get coverage outside of the US. Okay, some of them, Lakeside also has a pharmacy. So if you have a pharmacy benefits that it's covered outside of the US, you can get your medications shipped every month through us, okay? But you need to have that coverage through your insurance, okay? We will be managing your admissions since the beginning and to the end, okay? Here in San Miguel de Allende, the hospital that it's in our network is MAC Hospital, okay? Our primary doctor or your first contact that we try to give you is Dr. Grace Lim. She is part of Lakeside. She can handle everything since the beginning, and with the team that she has, plus the hospital staff, we can do the management of any specialty that you need, okay? Also, here in San Miguel de Allende, we have an agreement with an ambulance company that in case that you need an ambulance, we can send the ambulance to pick you and then take you to the hospital. And here it's something that I need to be clear. The company that we have, it's just have one or two ambulances. So sometimes there's not an ambulance available at that time. And on those cases, we send Red Cross or the ambulance that the hospital has. If Red Cross arrives and pick you, the thing is that we will not cover. But you will need to pay the ambulance trip, but I think that it's very cheap, no?
They don't charge Red Cross.
No, sometimes they charge 600 pesos.
No, I am in the Red Cross.
Okay.
So only if you go like outside of San Miguel.
Okay.
Say you want to get it, and then they will charge you, but here they don't charge.
Okay, so that's good. Good to know. So we will manage everything. We get the hospital cover, doctors cover. This is very important that you stay with our network providers, doctors and hospitals, so can Lakeside get covered. If there's arriving a doctor that is not in a network and is charging you, this is gonna be a little bit hard. On those cases, we talk with the doctor, we try to make an agreement, and everything gets. If you paid, it's gonna be hard because probably you will submit this for reimbursement, and when we send everything to the insurance they can say that they already paid the service. So that's why we need to have everything in the same package, okay? Also, for patients or people that doesn't have any insurance, there are some insurance or they don't qualify. You can have a travel insurance. We have some minimum requirements for those types. The only thing that for travel insurance, pre-existing conditions are not covered. So on these cases, we always recommend to have an air evacuation plan. Lakeside Medical Group has an agreement with SkyMed. So you can register with SkyMed and they will give you some extra benefits just to be Lakeside member, okay? So you can get in touch here with Sarah, so she can, and Robert, so they can give you the extra benefits, okay? This is something that I already told you. Canadians also, we have some companies. OHIP and British Columbia Insurance, they are not covered here in San Miguel. The only place that they have coverage is in Lake Chapala, in our facility, okay? Lakeside Medical Group has a clinic in Chapala. So, plus our network and everything, so it's the way that we can cover Canadians. All our members, they will receive one of these type of cards where it's going to be the name, the member ID, the type of coverage, and some emergency phones so you can call us. We recommend every patient to call us first, and then we will notify the hospital, so they will be waiting for you. Or when you arrive to the hospital, just always mention that you are a Lakeside member so they can notify us, and there's no any problem with the admission, or they can charge you or ask for a deposit, okay? The registration is very easy. It's online. You only need to fill with some demographic information, attach your insurance ID and your governmental ID. It can be your license, your driving license, your passport, your permanente, or anything that it's just like a legal document, okay? As I was telling you, what if you don't qualify for an Advantage plans? We have coverage with some travel insurance, and that they can tell you, okay? Lakeside Medical Group doesn't sell any insurance, okay? You are responsible of your career, of your having your insurance and your registration, but we have 3 brokers that can help you to have your insurance. Greg Hobby, Wes Chapman, and Michael D'Agostino. Greg Hobby is located in Sonora. Wes is based in the US, and Michael is in Chapala. These 3 brokers, they know how we work, what are the benefits that they need to look in your insurance when they are looking for, so you can have coverage here in Mexico through Lakeside, okay? There are some minimum requirements I was telling you from your insurance, and they already know which are the requirements that they know. Greg Hobby has a very good plan for people that they don't have insurance or they are less than 65. They have a good travel insurance company, and also includes air evacuation. So that's something good, and it's very cheap. Do you have any questions so far? Sorry.
They need the microphones. I'll screen them, because I've got 25 people on Zoom at once. So, okay, sorry.
But I'm gonna ask you some basics.
Yeah.
Okay, I have Medicare. Okay, Plan A, Plan B, Plan D. I don't even know what Plan C is. So, yeah, and I have a supplemental plan with Cigna that covers essentially everything. I don't even get a bill; they pay it all. Okay, so that's what I have in the United States right now. Okay, I get sick, I'll go back to the States. I get in a car crash, break my arm, I need to find a place here. Okay? I get sick, I don't want to go back to the States. I want to check into a hospital here. So my question is, at this particular point, okay, I don't have Lakeside, but I want it. Okay? After I leave this meeting, I'm going to go home and I'm going to say, how do I get Lakeside? So tell me what to do.
Okay.
right now.
The first thing is that we don't take supplement plans. So you will need to change to Advantage plan. Are you a full resident or you are partial resident here in Mexico? Partial? How long do you? Okay. The supplement plan will cover you just for the first 60 days and with a maximum coverage of $50,000. Okay, lifetime. The thing that Lakeside used to take supplement plans, but what happened? The insurance, they will not tell us how much is remaining on your 50,000 until we submit the claim. Okay, so this was part of financial risk the Lakeside was taking, and some patients, they were saying, we never used this before, and when we submitted the insurance sale, the patient already met the 50,000 US. And so the debt with the hospital, and we cannot charge you. So my first recommendation is try to look for an Advantage plans that can give you the coverage that you need for the next 6 months that you are in the US, or if you want to stay with Greg and can give you a travel insurance company plan, and you can be covered for the 6 months that you are here. Okay, and the way that it's the registration is you go through the website, that it's lakemedicalgroup.com. In the upper right hand of the website, it says application for membership. You click there, and it's easy to fill. Okay.
Good morning.
Good morning.
For those of us that have Advantage plans, how do we find out if Lakeside is accepting our particular plan? That's my first question. My second question is, did I hear you say there was one particular primary care provider at Lakeside? So if we have another primary care provider here already, would we have to change to this one?
Okay, the thing that with the Advantage plan will give you coverage for emergency and urgent care. So it needs to be something done in the ER, starting in the ER. You can send us information of your primary care. We can talk with them and register as part of our network. But the one that we have full time, it's Dr. Lim. Yeah?
Dr. Grace Lim.
Grace Lim, Lim. And I think that it was part of Rotary, no?
She was Citizen of the Year for Rotary a few years ago, yes.
And the careers that we don't take, it's Humana, WellCare, HealthNet, Scan, and we don't take, yeah? Most of them, they are reimbursement policies. So they will ask you to pay and then seek for any reimbursement from your own. They don't have direct payments, okay?
Questions?
So I understand that Lakeside does not charge the patient. How do you get paid? How does Lakeside make money?
Okay, the way that Lakeside make the money is that we have agreement fees with providers, and we have an agreement fees with the insurance. With those, that there's the profit, and it's when we pay your deductibles, your co-insurance, and everything, and after that, it's the profit. And we don't charge to the insurance extraordinary fees. It's what it's already registered and accepted.
So if I have a U.S. address, because I'm here and I'm there, but I still have Permanente here, but I'm here and I'm there, I can still use Lakeside, correct?
Yep.
Yeah.
You
All
are
need is
bi-directional.
yeah. Okay. Thank you.
Thank you, Ron. How do we register?
On the website.
Yeah, what's the website?
It's lakemedicalgroup.com.
We have one of our members that has gone through the process. His last medical visit here was covered by Lakeside. So Peter is going to just say what his experience was.
The experience was excellent. I have not paid anything, and the admission to Mac Hospital was easy, and the care was excellent. The only thing I heard was from my doctor, who said, who was resistant because I'm not going to get paid for 6 months, and also my staff, the surgeon, the X-ray technician, whatever, was not going to get paid for 6 months. And so I felt like, with my doctor and her staff, I felt like a second-class citizen.
We have agreements with providers, okay? Obviously, everybody wants to get paid immediately, but everything it's already took. Yeah, so you don't need to worry about that. Sometimes delays are from the providers to send us the records or to send us the file. So until we don't have this information, we cannot start the payment process to the providers. Yeah, they know already the process.
As of 3 months ago, my doctor gave me kind of the third degree because they weren't going to get paid in 6 months. That's the truth.
Well, it's going to be, I need to check the case directly. Okay?
I think we can all relate. If we're in the U.S., same thing happens, right? Exactly the same thing happens. There's paperwork, and it takes time to get reimbursement in the States when you submit at least that long. So I think they're not used to it here in Mexico because we're a cash economy here in Mexico. So they're not used to what we experience all the time in the United States. It's exactly the same.
It's my understanding that most of us who live here permanently are technically out of compliance with the rules because we don't live in the United States. We have addresses in the United States, but we don't live there. Does that ever cause a problem for Lakeside in long term? I mean, why doesn't it?
Because most of the patients, they go at least one time per year to the U.S.
But it's about how long we live there.
They go at least one time per year to the U.S. So there's always a renewal of when you're out traveling.
So it's just slipping under the wire by going back once a year, because if they find out, and they did this to my friend, he didn't understand that he couldn't tell them, he couldn't say that he lived here, and he lost his Medicare. He had to wait until the next year to reapply.
It's case by case depending on the career. The career is the one that gives you the limitation, not Medicare. Mm-hmm. They will send you the information to that address. It happened that, for example, with a company, with a career, there was a group of people that they were registering the PO boxes. So they found out that there was PO boxes, so they take out those patients, okay? But it must have an address, real address in the U.S., okay?
Good morning.
Hi, good morning.
I have a daughter that lives in the States, so I can put that address, but I'm a Mexican. Does this system works for Mexicans?
Yes.
See? And do I have to go each year to the U.S.?
It will be depending on your career, what are the conditions that they give you. There are some insurance that they will give you 6 months coverage. They are gonna some that gives you annual coverage. This is gonna be depending on the career. You need to check.
Okay, thank you.
Thank you so much. That's all the time we have for questions. I'm sorry. I would suggest you go to the website, or will you be outside, or will you
I
stick
can be
around?
outside and answer.
So you'll stick around for questions and ring the bell, Dorothy. That's it. Thank you all for coming. We appreciate it. We'll be here same place, same time next week.